Billy is a consultant at UNODC responsible for the civil society team's work related to the Commission on Crime Prevention and Criminal Justice, the Commission of Narcotic Drugs, the United Nations Convention Against Transnational Organized Crime. Billy is the founder of the United for Education and Sustainable Futures, whose flagship project is Youth Education Ambassadors. He is also the co-founder of the Regional Academy on the United Nations, founder of International Security and Conflict Analysis Network, a visiting lecturer of international conflicts and development, and a certified trainer in international security. We have with us Billy.
Thank you so much for, Thank you so much for your kind introduction. I'm very, very pleased to be here on behalf of the United Nations Office on Drugs and Crime to be with so many participants, civil society participants, but also on the first day, government representatives. It's an honor for me to have been invited by Fourth Wave Foundation and WFAD to this particular event. And I'm looking forward to what I can share with you. I think it's actually very, very difficult to know where to start, to be quite honest, after listening to so many inspiring presentations for the last 2 days. It's almost impossible, and it's going to be a very tough task for me to keep you inspired for the rest of the afternoon. It's been very, very inspiring for me, and I hope that I can make a contribution to this. So the way that I see how this is going to be, at least for my presentation, my part, is that I have been hearing about what is actually happening on the ground, what you are doing in your communities very, very successfully. And what I am going to try to do is to kind of give you a framework under which, within the international system, under which those activities can actually work better. What kind of systems do we have or policies do we have within the UN system that can actually help you do your work better, or you're actually already contributing to without even knowing. So that's going to be this afternoon. And then later on, after my first presentation, I would like to do it a little bit different, right? So not presenting, but actually put you in groups so that we can do a very interactive activity together. One of my, in my resume, what they said is that I am a certified trainer, so actually I like to do active things, give trainings. I don't really like to give lectures. I rather give trainings, and therefore we will actually do a very practical exercise on how your work can be done better within international context. So that's what I have in mind this afternoon. And just before I start, we just want to play a video about the work of United Nations Office on Drugs and Crime.
I am proud of the support UNODC provides to countries to tackle the interlinked problems of drugs, organized crime, terrorism, and corruption. And I thank you for your important work to safeguard the agreed UN conventions, standards, and norms.
Yeah, as you can see, UNODC does a lot of things. It does pretty much almost everything that is related to what you do in your work, whether it's at the heart of the causes of the interventions that you actually plan or the problems you are addressing, or whether there are effects of some of the problems you are addressing, or they are affecting or at the heart of some of the effects that we are seeing. So issues related to terrorism, for example, I mean, this is another very sensitive issue that we're working on, which is directly, you can find a direct link to drug trafficking or drug issue in general. So this is what I have in mind for you. So I'm going to take you through what we call the 2019 Ministerial Declaration, which is a recent member states' agreement on how they can move forward in addressing the world drug problem. And here I will probably ask the help of my good friend and partner, Espion, who is a civil society person who actually has been there from the very beginning in 2008, to just give you a civil society perspective as to how we've gotten there. And then after that, I will give you a little analysis on how and what the declaration is and how you as civil society fit into that. You might, some of you who are familiar with the Angas outcome document, you might already, you can already see where I'm coming from. So my reference is really from the 7 chapters of the Angas outcome document to kind of show you how your work is related to that. And then, as I mentioned, we'll do a very, very interactive session from which I am really hoping, and I'm very glad that the governor yesterday actually emphasized the need of coming up with concrete recommendations, concrete proposals. This is also the aim of this interactive session, so that we can, in groups, try to come up with certain recommendations on how we can do better, how we can plan better interventions in order to address this problem. So, how did we get there? Espion, if you don't mind, I'd like to invite you to come and help me to explain to this. I can explain it myself, but I think this is a civil society conference, and I think it's better to actually hear from a civil society person who's been there from the beginning, who's been our partner for the last several years. Espion, please.
Thank you. No? Hello? Okay, use this. I take this, the blue one. Okay. Well, thank you, Billy. And let's say that I started with the UN and illegal drugs in 90s, in the 94, something like that. And some of you have met me from that moment. I will not say any names. But anyway, 2008, I decided to go to Vienna for, I have only 2 minutes, and I spent 11 years for this. But in 2008, there was 1 week's meeting with, I think it was 800 civil society organizations, discussing the upcoming political declaration and plan of action for the UN when it comes to illegal drugs. And we came to a consensus, what we call the Vienna and UNODC 2008 declaration. And that has been the foundation stone when it comes to how civil society should act when it comes to different things. We were not united in every question, but in the end we had a declaration that was civil society. In 2009, there was a political declaration and a plan of action going for 10 years. They have this in the UN system, and that was taken in New York. At that time, also the countries were starting to be divided, as it is today. It's like the normal thing in the world, more or less. And when it comes to drugs, it's also divided, you know it, between some countries that are going for legalization, some countries that are very doing for no, not representation. They are going on the other side for legalization. They are key. Yeah. And then they decided they wanted to change the venue from Vienna to New York, because in New York there was more political power for some countries to deal with the narcotic drugs issue. That was not the case, because they said that CND should be in Vienna, but during the period, they said we will have a special session in 2016, the UNGAS 2016, between the 10 years span. And we gathered in New York, even there, 800 organizations from civil society. And we had the influence, and as Billy might say, or another speaker said, 11 times in the outcome document, civil society is mentioned as one of the key actors between the governments, between academia, between other business partners and so on. And then from before UNGAS 2016, we created what we call the Civil Society Task Force, because we needed to unite in a special way. And we had quite a good impact. And after 2016, we came into the ministerial segment of 2019 in Vienna. So it has been a long, long process. But during those years, we have moved into the plenary hall in a way that we are now accepted as a key partner when it comes to implementation of what they say in the declarations, with the cooperations with with the governments and other resources. And the civil society has also learned the UN language and the UN behavior, you can say, and that's so important. What we need to do is to convince our leaders, our representatives in New York and in Vienna and Geneva, wherever, that whatever they say about civil society from this place, they should take it back to capital and continue to work with us, and not only saying it in those introduction language. No, Billy.
Thank you so much. Thank you so much, Esbjørn. Yeah, so, I mean, you just heard from someone who actually is one of you, who has been there from the very beginning. I mean, let me just take the blue one. I think the blue works better. My favorite color is blue anyway. Okay, yeah, so yeah, you heard from one of you, and I think one of the key sentence or the key information he just gave us is what happens when those member states agree on these particular policy documents and they go back home, right? The idea is that they implement those policy documents, but how can they do that? And I think the message that I've been hearing here, and I've been in this particular conference, in many different other conferences, is that they cannot do it alone. Okay, they have to find a comprehensive way to implement these policies, including civil society organizations, right? So that's the key. And that's why you're here, and that's why we're here. And the other key point that I have been listening or heard throughout this conference is that you civil society organizations also see the need to actually have your capacity built, right? You need to have your capacities built in order to do your work better. And this is really pretty much why I'm here. This is what my team does, to try to facilitate the work of civil society organizations in different parts of UNODC mandates, right? So, before I go to this one, or maybe before I go here, Esbjørn told us how we got here. But let me just see by the show of hands, how many people were aware of the 2019 Ministerial Declaration before I started my presentation? Okay, so I see a handful of hands up, like 5, 6. Okay, so I'm probably in the right place, right? Okay, so I'm probably in the right place. And it does not mean that you actually are not contributing to it. You are actually, you know, given what I've been hearing, you are actually doing a lot of work that is contributing to this. So what happened then when we were in Vienna during the ministerial segment, what happened? There we had a record of 2,200 people attending this particular event it was that important. These were government representatives, civil society organizations, and other stakeholders. We have had, in fact, about 500 civil society representatives in Vienna for those, it was 1.5 weeks or so, right? From different 90 civil society organizations. And there, Espion mentioned the kind of the flexibility that actually member states created in terms of how they engage civil society organizations after the Angers outcome document. And ours to open the doors pretty much to civil society organizations to be involved. And here you can see, I put on a slide just over here, during these two interactive and multi-stakeholder roundtable sessions, right? It's not usually easy for civil society to get a slot in those particular roundtables because this is an intergovernmental meeting, meaning this government representative coming and discussing what they should do. But as a result of the good work of civil society organizations, member states have been convinced they actually deserve a place at the table. And so they were invited to be part of this roundtable discussions as well, to give presentations about the work that they are doing. And this was facilitated by the Vienna NGO Committee on Drugs, of which Espion was a chair for many years. Okay, the other thing is, one of the things that really I think is very important is that you as civil society organizations actually meet the people who are helping countries to implement these policies. And this is UNODC in this particular case. This gentleman that you see here is our executive director. This gentleman here is a new chair of the Vienna NGO Committee on Drugs who replaced Espion, right? So we bring them together to discuss in a panel how civil society can and are contributing to the world drug problem. And I will talk about this particular booklet later on. Okay, so we have the 2019 Ministerial Declaration. It's a declaration. It's a declaration, right? Which means it's not a policy document. But it's a declaration that affirms the different policy documents that member states have adopted in previous years, as Espion has mentioned, the 2009 Political Declaration and the 2014 Joint Ministerial Statement and the 2016 Angers Outcome Document. It was a confirmation of those policy documents. Now, the analysis that I'm going to do, I'm going to try to give you an analysis of what this document actually contains and how it relates to you. It's not an easy exercise. It's not a long document, but it's a political document. That means the language is a political language as well, right? And my starting point is actually the 7 chapters of the Angers Outcome Document. Are you familiar with the Angers Outcome Document? Okay. Diana, I think they already received information about that, right? So I made sure that I send the organizers the information so that you can actually read through those to prepare for this session. So in the Angers Outcome Document, we have 7 chapters. So, and those chapters were also affirmed in the 2019 Ministerial Declaration, and that is my starting point, to see how the Ministerial Declaration references or sees those 7 chapters and give you examples of what civil society organizations are doing to help you understand that political language a little bit better, okay? So let's do that, let's start. Okay, the first chapter is on demand reduction, okay? Now again, it's a very long text, but what I've done is simply to take the text or the reference that was relevant to demand reduction here. Member states in this particular case, they use a political document, as I said. They agreed to strengthen effective, comprehensive, scientific, evidence-based demand reduction initiatives, covering prevention, early interventions, treatment, care, recovery, rehabilitation, and social reintegration measures on non-discriminatory basis, right? This, if you read this, it's a political document, but really these are the things you've been hearing for the last 2 days. Probably you're going to continue hearing tomorrow as well, in the work that you do and your colleagues are doing here. What we also did is to do a little bit of an analysis to see how is this actually linked to the Sustainable Development Goals, because we talk about Sustainable Development Goals a lot as a framework that actually helps us not only to plan interventions, but actually also to evaluate how we are doing. So we have seen through our analysis that this particular chapter is related to SDGs 1, 3, 4, 5, 8, 10, 12, and 17. I'm not going to go through them because I am sure you know what they are, right? You know what the SDGs are. Probably it would be nice also if you could do a little bit of analysis to see which of the SDGs is your work is actually contributing to. I think it's a nice exercise to actually do. So to illustrate what this actually means in an NGO context, I pulled out an example that you might be familiar with of the work that is related to this. Without saying too much, the project was presented yesterday. Vendor, no. Say no, right, to drugs and every other bad things. This is, in terms of what this particular chapter means, this is actually one of the examples of what it means, right? To do projects related to demand reduction. And again, here I'm not going to explain what this project is because you already know. Okay. Chapter 2, this is on availability of and access to controlled substances. And here again, what is important is that member states agree to ensure access to and availability of controlled substance for medical and scientific purposes. I'm sure those of you who are familiar with the work of the UN, this is our position, right? So we do not advocate for the availability of substance for any other purposes other than medical and scientific use, right? Including for relief of pain, suffering, and address existing barriers in this regard, including affordability. Now, I do not know the context of India, but one of the problems that we have around the world is that certainly for scientific and medical purposes, availability of some controlled substances is a big problem. It's a major problem in some sub-Saharan countries, in Asian countries. Again, I'm not sure about the case of India, but this is one of the main aspects that they have agreed on. And here, again, the three SDGs that are related to this is 1, 3, and 17. And to illustrate this is one example of what one of the NGOs is doing. And by the way, if you have a good example, you can send it to me. We continue to update our guide, and we can actually put that into our publications. This particular organization, the International Association for Hospices and Palliative Care, is working to ensure that universal access to high-quality palliative care is integrated into all levels of healthcare systems. In this particular, in the case of Colombia, right? So they're not doing it everywhere, but in the case of Colombia, this is a project that they're doing. So this is what it means for you as civil society organizations. How about supply reduction? Okay, here member states they agreed on a number of things, really. I mean, you can see many points. Again, this is usually it's a long document. And I found these 4 points being most relevant to this, and to you as well, of course. And this is the issue of the prevention and countering illicit crop cultivation and the production, manufacturing of and trafficking in narcotic drugs or psychotropic substances, including synthetic drugs, new psychoactive substances. Also, the issue of reducing and eliminating the diversion of illicit trafficking in precursors and money laundering related to drug-related crimes. And then, of course, issues related to addressing socio-economic issues related to illicit crop cultivation and production. Here, I mean, when you talk about these particular issues and you think about why communities actually cultivate drugs or do drugs, there are a lot of socio-economic issues out there that some of you as civil society are actually addressing. But they're also committed to strengthen bilateral, regional, and international cooperation promoting information sharing. This is key, right? Because drug trafficking, for example, is one of the transnational organized crime, which is the other part of the work that UNODC does. So it's a cross-border issue, and sharing of information is quite key. What does this mean for you as civil society, or what are some of the examples? First of all, those are the SDGs that are related to this particular chapter. And in terms of what civil society are doing, we have an example of this particular NGO, I think it's from Argentina. They work to foster and protect human rights and to strengthen the democratic system and the state in the state of and the state of law in Argentina. And here they're implementing a project called the Internal War: How to Fight Against Drugs. How to fight drugs pretty much in Latin America, right? Okay. Moving on human rights. I heard, the sessions that we started with this morning, they were really focusing on this particular issue of human rights, particularly, of course, women and children. Well, we started children, I think those two categories pretty much more children and young people. And here, member states, they again affirm their commitment to a balanced, integrated, and comprehensive multidisciplinary and scientific evidence-based approach to the war drug problem, based on the principle of common and shared responsibility, and recognize the importance of appropriate mainstreaming gender and age perspective with a particular focus on women, children, and youth. And again, I'm very happy that the organizers actually made a good effort to include young people in this particular conference, especially in tomorrow's sessions, because like many other delegates actually said, and I think there's a delegate this morning who said we should regard young people as citizens of today. That's a powerful statement actually in itself. It almost goes without saying, but one of the issues that we see around is that young people are seen as citizens of tomorrow. And you know, tomorrow never comes, right? Tomorrow, there's always going to be a tomorrow, okay? Today is today, tomorrow is tomorrow, but when we are tomorrow, there will be another tomorrow. So what we have seen is that young people have just been ignored pretty much in many respects because of this particular approach. So I'm very glad that the organizers put a particular emphasis and gave space for young people here. This is what we see in the UN. This is what we believe in the UN system as well. We really should give more space to young people at the table, especially when the policies are being discussed. The youth-focused policies are being discussed. Young people should be there and provide their input. And here, the SDGs that are related to this are there. And I put out an example of another NGO that you might be familiar with. I'm not sure whether Roger Kazir is in the house. Roger's, he's probably not here. Okay. They present, I think he was at the panel yesterday. He did present what they're actually doing with young people over there to enhance socioeconomic transformation of disadvantaged young people through advocacy, psychosocial and skills development for self-reliance. And here again, creating resilience within communities. I think it's part of a prevention effort, right? Creating resilient communities, especially young people. Okay, how about the issues related to persistent challenges and threats? Okay, here we see that member states are certainly committed to facilitating informed scheduling decisions on the most persistent, prevalent, and harmful substances. And here, as SBO knows, those of you who attend CND intersessionals, I think in September, in fact, we're going to have a particular intersession that is also going to include scheduling. There are always new drugs that are coming, and how can you control those drugs? One of the work that UNODC does, together with WHO, particularly actually most of the work is done by WHO, is actually to do this regular scheduling to see what kind of drugs do we have, what kind of new drugs do we have, and where can we schedule the existing drugs? Maybe the trends have changed, the effect of a particular drug has changed. Where can we schedule that drug so that countries can actually put in place policies to deal with it, within law enforcement, within communities? And here, SDGs are 3, 5, and 8. The example of what is being done in Italy, for example, by one of the civil society organizations is looking at reacting to emergency causes by the rise of substance abuse among young people. A lot of other NGOs, I think they have been doing, they have presenting the work that they're doing, have kind of rehabilitation centers where young people come and actually seek help of all kinds. So very similar to what this particular organization is doing in Italy. Okay, how about international cooperation? This is pretty much a little bit easier to understand. Member states here dedicated to strengthen bilateral, regional, and international cooperation. This is, of course, important because the drug issue, like many other issues that communities are facing, they are very national. Sometimes they're very local, even, but they're also regional in nature. So. Improving or increasing bilateral, regional, international cooperation is quite key to addressing the war drug problem. Of course, because there's again the other issues that is related to drug trafficking is, for example, corruption, right? It's probably a subject you're familiar with. I don't know the context of India, but I don't work in this region. But I have a colleague in-house who is in our UNODC office in Delhi. But yeah, corruption is one issue that actually needs to be addressed if you want to address the issue of drug properly. I mean, we did a study, UNODC did a study on, we were trying to understand how can we achieve SDG 3 in Nigeria, for example, right? Nigeria is one of the biggest African countries, and what we realized was that during our studies, we realized that the most corrupt area in Nigeria was the law enforcement. Law enforcement is the most corrupt institution in Nigeria. So if you want to achieve SDG 3, which is well-being and health, and you have a law enforcement that is completely corrupt, and you have a lot of drug trafficking in Nigeria, as you know, how do you achieve that? You cannot achieve SDG 3 in Nigeria if you do not address corruption, right? The same we did in Eastern Europe. I mean, somebody from Serbia, I think, a lady, our colleague who presented yesterday from Serbia. Sorry? Yeah, in any case, so in Serbia, for example, the most corrupt area, she can testify to this, in Eastern Europe is health sector, hospitals. You cannot get a hospital bed if you don't pay corruption. How can you achieve good health if you have, corrupt hospitals? It's almost impossible. So, and here the example of, in terms of international cooperation, what UNODC what civil society is doing is, for example, the work of the Vienna NGO Committee on Drugs, right? A lot of you, hopefully, are a member of the Vienna NGO Committee on Drugs, right? Yes, exactly. So that's great. I mean, that's one of the work that civil society can do. Facilitate this international, regional cooperation among civil society organizations. Member states, this is how they do it. You have to do it for yourselves. I mean, they're not going to do it for you. So obviously, this is one example of what a civil society organization can do. This is the last chapter. And it's probably one of the complicated chapters, alternative development. Because again, it goes to the heart of why do people actually cultivate drugs, right? And here, member states reiterate the resolve to strengthen the implementation of long-term and comprehensive development-oriented drug control policies and programs in order to address drug-related socioeconomic issues related to illicit crop cultivation. We have one of our projects that we have, for instance, in Colombia is an alternative development project to provide alternative means of cultivation to the local communities. Because I personally think that people, they don't necessarily have fun cultivating drugs. I don't think they like it. I don't think it's the most productive plant that you can actually have. But if they don't have an alternative to that, what are they supposed to do? You know, one of the things that I actually talk about, because I think what you are actually doing is actually planning interventions for a particular security problem. Believe it, it's a security problem that you are dealing with. It's a social security, right, that you are dealing with. So, and if you know a little bit about the concept of security, it all comes down to what? It all comes down to survival, okay? It all comes down to survival. So if you have to cultivate drugs to survive, I think you're going to cultivate drugs. If you have to do drug trafficking to survive, I think you're going to do it. Sometimes we look at these people and they almost sometimes look, you know, seem alien to us. But I'm not sure. I'm not sure if when it comes to the issue of surviving, I think any one of us will do exactly the same thing. Trust me. I'm not sure what you do when you have to ensure your survival. I hope you're not doing that. But to be quite honest, when you're desperate and you want to survive, you will do it, okay? You will do it. So, in any case, so that's the issue. You have to provide alternatives. And actually, one of the good things that I like about this conference, what I've been hearing, is that you are providing a lot of alternatives. You have to provide incentives too, right? People are not just going to be convinced. People talked about young people being told that using drugs makes you feel good. If that's the message, they're going to take it as that, unless you give them an alternative, right? And an incentive, if they have already started, in order to come back, they need a good incentive. So we need to provide that, and that applies also with regards to alternative development. And those are the SDGs that are related to it. And here I put out an example from Thailand. I'm sure SBO knows this particular organization. They're doing a lot of work to help people living in poverty and in marginalized communities, to provide them with different types of alternatives to cultivating drugs in this particular case. And they say that thanks to their work, the beneficiaries no longer need to rely on drug, crop cultivation, or other illicit activities to survive. Right? I mean, I didn't even know that word was there. Survive. I didn't even know it was there. But they were doing it because they needed to survive. So obviously, that's quite key, I think. Okay, so that was the analysis of a very complicated policy document that we actually tried to put it in a more, let's say, comprehensive, easy to understand language for you to actually be able to navigate through. If you are interested, of course, in you should have, perhaps, and if you have not read through the entire document so that you have a complete, comprehensive picture, but this is actually what it is when it comes down to, right? And one of the other things, as I mentioned earlier, that we are doing to help or to build your capacity is to publish guides, right? Different guides on how to use the 2019 Ministerial Declaration, or what it means to you as civil society organizations, and what are some of the work that is being done by your fellow civil society organizations. And we launched this particular one actually in Vienna in March during the ministerial segment itself. And the examples that I showed you, they are featured in this particular guide. So Diana, she has a copy of that. It's actually very nice and it's flexible, that we have an online version that we can update often, as much as we want, and we can feature as many examples of your work that we want. There's no limit to that. So if you have an example and you would like to send it to us, we'll be happy to include it in our next version. Okay, then I think I'm done with my analysis. So the idea now is that based on this and what you have already received, that we work together in an interactive fashion to try to see, okay, what does this actually mean to you and your work? And how can you do your work better, right? So based on this particular one, because again, I think there's a need to come up with concrete recommendations, and I think we need to facilitate that process as much as possible. And this is going to be pretty much for the rest of this afternoon, right? Before I go there, Dan and I will, and our colleague here, we were discussing how do we do this, and I think, what did we agree on? By country? Country and region. So, because again, this issue is very particular, we would like to divide you in countries and regions, and you work in those groups, because the recommendations that you're going to come up with are probably going to be country or regional specific, right? So it makes sense to actually, that actually you work in those groups so that we can come up with as close to, real concrete recommendations as possible. Yeah, is that agreeable? Right? Is that agreeable? I think we can do that. Here are the tasks. I think you're going to take your time. We probably have more than an hour for this, right? Based on what you have already received, the summary of how the different chapters are related to the ministerial declaration, which aspects of this declaration, meaning the demand reduction, access to medicine, and so on, which ones of those do you feel are more relevant to the work that you are doing? Okay, that's probably easy to do because it's your work. You just have to connect it to this, right? And then this point number 2, actually, I added it to my slides. I didn't have it. I added it after listening to you and everybody these past 2 days. I think, in my perspective, in my view, I heard a lot of wonderful work that you are actually doing. And I'm sure you already know number 2, but I think it's important to remind ourselves, why are we actually here? Okay? We didn't have to exist, or you didn't have to exist as NGOs. You exist because there's a problem, right? So why do we have that problem? I think, if possible, it's good to go to that level and see why are we actually even here. We shouldn't be here. So what are the underlying causes of the problems we are addressing, you are addressing in your NGOs? And then discuss how you can put, how you can put the different aspects that you have identified into practice. This is probably also easier because, again, it's what you're doing already. And then what are the main challenges? Right, in some countries, it's probably the lack of political will, right? In other countries, it's probably just in societal issues. Maybe it's corruption, maybe it's something else. What are some of the challenges that you are actually facing in doing your work? And then we would like that you discuss some of the recommendations based on those previous analysis that you would have done. Discuss some of the recommendations. So what new interventions or what existing interventions can we put in place? I mean, can we improve? What new interventions can we put in place? Or which existing ones can we improve in order to do our work better? I think this particular part will also fit into what the overall conference recommendations actually, right? So maybe that's a good starting point to put it to you to help the organizers to put together that particular summary. And then perhaps this probably is, for me personally, at UNODC, for us at UNODC, it would be good to know what kind of support would you actually need to do your work better, right? The governor said yesterday he's ready to support. What do you want him to do? What do you want him to do? Give you money? Open up his doors so that you can go and talk to him? What is it that you want? I think it's quite important to be actually specific and to think about and say, what do I actually want, right? From the UN, from other NGOs, right? Is it more networking? Is it more cooperation? What is it that you actually would want in order to do your job better? And then it would be great if you could present the outcome of that. Instead of me being here or anybody else, then you would take the floor and tell us, okay, this is actually what we have come up with as a group or a region or a country, and this is how, these are the recommendations that we can suggest, you know, for all of us to do our work better. So this is the agenda for the rest of the time. I hope it's agreeable. Is it agreeable? Yes, thank you very much.